Welcome to another session of Your Concerns in Health, the program that addresses your questions and concerns about your health and your health care. Today's topic is sun protection. Skin cancer is the most common form of cancer in the United States. Last year, in this country alone, there were over 2 million new cases of basal cell carcinoma and squamous cell carcinoma. And the bad one, melanoma, had over 70,000 new cases. One person dies of melanoma every 62 minutes in the United States. Not only is the sun damaging to the skin, it can also be very harmful to your eyes. To help us with our discussion, we brought together a panel of medical experts, dermatologist Dr. David Gorsulowsky and Dr. Anna McNay, and ophthalmologist Dr. Stephen Anderson. Thank you. Welcome to you all. The Center for Disease Control and Prevention is leading efforts to educate people on how to reduce their chance of skin cancer. They want to encourage adults and children alike to protect themselves from the sun's ultraviolet UV rays. But before we begin our discussion, let's hear what some of the people in our community are concerned about and what specifically they're doing to protect themselves from the sun.
I would say damage to your skin, wrinkles, skin cancer.
Dangers are probably getting sunburnt or, long-term skin cancer, something like that.
It ages
UVs, ultraviolet rays.
Yes, you get sunspots, which I have, and also cancer.
Melanoma,
right.
Skin cancer.
Exactly. And being dark complected, I'm also susceptible to those. I thought I wasn't because of my complexion, but you are.
Easiest is sunburn, but melanoma, skin cancer, not fun stuff.
Skin cancer, discoloration of the skin in different areas, premature aging, wrinkles, sunspots. They can bring on moles, freckles, and I guess peeling of the skin.
Put on sunscreen every day. All my lotions have SPF. And my face moisturizer has SPF in it.
Sunscreen.
Well, I always carry sun protection with me because it's imperative. In fact, let me show you.
Lots of sunscreen oil. My wife's almost totalitarian about that.
I just wear sunscreen. I'm actually, I hate to say it, I'm a sun lover.
We always wear hats. We usually wear sunglasses. Lots of sunscreen. And we often try to use sun protective shirts.
Probably stay in the shade and keep sunscreen on at all times and, apply a lot.
Protecting my eyes is very important. I wear prescription glasses, so I do tend to wear the sunglasses more, I think because they are prescription, and I do need them.
My kids and I wear suntan lotion all the time. We apply it before we go swimming, throughout the day.
I use UVA, UVB ray protection sunscreen, and my sunglasses also have UVA, UVB ray sun protection to protect myself from the sun.
Let's address these concerns and misunderstandings. Let's start with you, Dr. Gorsulowsky. Why exactly is the sun so dangerous?
Sun exposure is something that all of us receive on a daily basis. During our jobs, during our errands outside the house, at home, working in the yard, all of our daily chores. And because it feels good to have sun exposure, some of us forget that those rays that also make you feel good can permanently damage several layers of the skin. And the reason that it's so dangerous is that the exposure that we receive on a daily basis is cumulative. The damage accumulates over a lifetime, beginning in infancy, and once we are adults, that amount of damage is permanent and it is irreversible.
What particular layers of the skin does the sun damage?
The sun damages both the top two layers of skin, the epidermis and dermis, and because of that, there can be proclivity or predisposition for skin cancer. But with damage to deeper layers, the effect is that of aging of the skin. So much so that we have quantified, we talk about in our literature, the amount of aging that occurs, and we call it photoaging. And the amount of photoaging depends on the amount of sun exposure. So the predisposition to skin cancer, but also accelerated aging of the skin, both happen with repeated sun exposure.
Dr. Anderson, what about the eyes? Is that a cumulative exposure also?
It is a cumulative exposure. The most common findings on the surface of the eye from a long-standing sun exposure would be a little yellowing on the white part of the eye, most often toward the nose side of the eye. You can even get cataract formation from a lifetime exposure to sun. And skin cancers are also pretty common on the lower eyelid. The lower eyelid is exposed to sun more directly than the upper eyelid, and as a result, the skin cancers tend to show up more frequently on the lower eyelid.
Are some eye colors or eye types more sensitive than others?
Yes, it's been shown that people with lighter colored eyes, the blue eyes, green eyes, hazel eyes, are definitely more sensitive to sun exposure, especially when it comes to sun exposure inside the eye, and that would be the cataract formation and even macular degeneration. People who get macular degeneration often are people with blue eyes or lighter colored eyes and lighter complexions.
You also explained that macular degeneration is the #1 leading cause of blindness in the U.S. too?
In the United States it is. It is an aging process. It's in the back of the eye and a part of the retina, and we use the retina for everything we look at, so it's a very important structure, and sun exposure is a risk factor for macular degeneration.
What about in your practice? What do you think the percentage of people you see have problems related to sun exposure?
I would say every day. I see every single one.
Every day, really?
Every day, every day. I think there is a stigma that you don't have to wear sunscreen on a regular basis. So when I ask a patient about the history of sun coverage or sun protection, they will say, well, I wear it when I go to the beach. And unfortunately, that is not what I want to hear. We are exposed, like Dr. Gorsulowsky has mentioned, to UV radiation every single day. So even though we work indoors, we still drive home. We go to the park with our children, and those are exposures that we are getting sun or radiation without protection.
Well, let's talk about UV exposure. I mean, that's a big word, but it means there's lots of different kinds of light forms, aren't there?
Yes.
Are they all bad?
On the electromagnetic spectrum that we learned back in physics class a long time back, we learned that there are many types of radiation that come from the sun. We have been able to quantify and study ultraviolet light in its three forms, A, B, and C. We're primarily interested in A and B.
And that's what UV stands for, ultraviolet.
UV is ultraviolet, and those rays are the ones that we're discussing here that cause the damage, cause the aging, predispose our patients to skin cancer. So that is UV, that is ultraviolet.
What about the eyes? What UV damages the eyes?
In addition to the cataracts and the macular degeneration and the skin cancer issues of the eyelid, ultraviolet can cause other types of tumor. It is actually possible to get a melanoma inside the eye. There's a layer in the back of the eye that is normally pigmented and is susceptible to sun damage, and melanoma can result. It's important to protect the eyes just like you want to protect your skin. They don't make any type of sunscreen that goes directly in the eye. That's not a safe way to protect your eyes, but obviously wearing sunglasses that provide both UVA and UVB protection are critical for protecting the eyes.
So what do you do with your own skin? How do you protect it?
Actually, when a patient talked to me about that, I told them, don't just rely on sunblock. I put it as an analogy. I said, The best way to prevent pregnancy is abstinence. So the same thing when it comes to sun protection. If you don't have to be out there between 10 to 4 and expose yourself to the radiation when it's strongest, that's the best. Then rely on sunblock, but also make sure you have clothing, hats, stay in the shade, and stay away from reflective surfaces. If you're taking your children to the pool in the summer, stay away from the water, maybe stay in the stand, go under an umbrella. Those are important things to do.
Are those rays reflected the same? Is it just automatic reflection of the UV light then?
Definitely, we've been able to measure the amount of reflection that comes off ground, cement, sand, and snow. And for example, those who might snow ski should know that the amount of ultraviolet that's reflected off the snow is probably about 85%. So it's almost like having another sun hitting you, hitting twice, one from above and another off the reflection. So that is a very important point, and our patients who say, I wear my hat when I'm out, thank you, that's a good idea to wear the hat, as Dr. McNay said, but in addition, you need the sunscreen protection because of the reflective light coming off the ground and other surfaces.
I don't quite understand how sun radiation damages the eyes. Do you think you could explain that, Dr. Anderson?
Yeah, a lot of the surface of the eye and also the natural lens inside the eye that you use to focus light is made of proteins, specifically the collagen protein. And for light to pass from the front of the eye to the back of the eye, these collagen fibers are lined up in a very specific parallel pattern, and that makes parts of the eye transparent so light can enter the eye. And UV exposure can actually break down some of these collagen bonds and make those collagen protein fibers lose their parallel shape and lose their clarity. So as a result, you can get cloudiness in the lens of the eye, and that's cataract formation. You can also get some degenerations on the white of the eye. Those are the yellow patches and the bumps on the white of the eye. And that's mostly due to deterioration of the collagen from UV rays.
And can you explain again about the skin damage? It damages the top 2 layers, but then it can damage the deeper layers, causing aging?
First of all, I want to mention that when Dr. Anderson mentioned how the sunlight cause more trouble with patients with light skin and light hair, definitely we see the same kind of patients with more skin cancers, light skin and light eye. However, I want to emphasize all skin types of patients should wear sun protection because they do get damage as well. In terms of ultraviolet light, the way I explained to my patients, I said, remember, UVA, UVB is what we get on this earth. UVC, we're semi-protected so far with the ozone layer. Now, there's controversy about the ozone layer, that's another talk. In terms of A and B, A, think of it as aging. It's a longer wavelength light, so it actually penetrates to the second layer of the skin, which is the dermis. So you actually don't see much damage until later in your life. It causes age spots, the wrinkling that we ladies don't like, I guess men too now. And B, think of it as burning lights. It actually causes those sunburns that we'll feel. And what's interesting is if you get a sunburn, you may not feel it for at least 24 hours. So sometimes it is quite deceiving. A patient may go to the beach, put the sunblock on and think they're protected, and then wait, I'm fine, and then wait a day, go right back to the beach before the sunburn really showed up and got fried again. And so those are things that, we're to be careful of.
But how does it damage the lower layers of the skin then? In the eye, it damages the proteins made of collagen. Is it like that in the skin?
It's very similar, Barbara, because the second layer of skin, the deeper layer, is made up of collagen and other proteins. And clearly the skin is unable to repair itself adequately after excessive sun exposure. And with that cumulative exposure that we were talking about, it becomes more difficult for the skin to repair itself. Those proteins that Dr. Anderson was talking about are also changed in the skin. They become abnormal. They do not support the skin as a box springs would support the mattress. And so wrinkling occurs on the top layer, and that leads to wrinkles, spots, and because of the abnormal proteins and collagens in the second layer of skin cancer.
And we've talked now a little bit about different people have different risk factors. The darker skin isn't always protective against skin cancers.
That is correct. We know that we need to be on the lookout, and we are very vigilant with our patients when we say, will you allow us to examine your total skin surface? And we would like for you to learn how to examine your own skin surface. So that's a skill that we help our patients to learn, and it doesn't matter whether you are fair-skinned or dark-skinned. We grade those layers or those amounts of pigment in numbers. So skin type 1 is a very, very fair-skinned patient. Skin type 5 has very deep dark pigment.
So Dr. McNay would be what, a skin type 1 or 2?
She's a 3.
Oh, a 3.
And we still ask her to protect from the sun, as she was saying earlier with her patients. And we don't.
What about Dr. Anderson? What would he be?
He is always #1 in our book, but he is skin type 2, and because he could tan a little bit. He's between a 1 and a 2.
Okay. And is he like me? I'd probably be 1 or a 2 also.
Between you and I are between a 1 and a 2. We can form a little pigment. But I'm glad you brought that up, because that formation of pigment is not protective. Dr. McNay already identified the fact that some of those rays penetrate through the pigmented layer of the skin, right down to the second layer.
So this is one of the myths that we're examining right now about, oh, I've got dark skin, I don't have to worry about getting sunburn. I can still get sun damage.
Correct.
Right?
Correct.
Okay.
And I've heard dermatologists say there is no such thing as a safe or a good tan.
That's correct.
Yeah.
Tanning is actually your skin's response to UV damage. Your skin creates that color to try to protect itself from absorbing more rays. So actually, when you get tan, you already have sun damage. The best thing, I think we both agree that the best tan is a tan in a bottle or in a spray. There's just no safe tan.
What about those tanning booths that people like?
It's interesting. We attended some sessions as recently as this morning regarding regulation of tanning, which is a hot topic now, and many of us grew up with tanning booths or even tanning apparatus at home because it accelerates the tan. One can get a tan very quickly, and instead of all day to get a tan, one can get a tan pretty quickly. And that means that that damage that Dr. McNay is talking about is quick. Not only is the tan quick, the damage is quick. And one can get concentrated damage in a tanning booth, a tanning parlor, and therefore, because of unfortunate young patients who have died, whom we know before age 30 from melanoma, from probably from excessive tanning over a lifetime, there is a move now to regulate the tanning industry. And whether one agrees with regulation or not, it certainly points out the fact that tanning and prolonged tanning, excessive tanning in the tanning booths definitely accelerates the rate of damage and makes a person more susceptible to aging and cancer.
Well, and Dr. Gorsulowsky said it was actually melanoma, not just basal cell or squamous cells, which even though they're cancers, I think that they're not as bad if you don't let them go as ones like melanoma that can metastasize to other areas.
Not just that, also UVA suppress your immune system. So if you get a concentrated amount, you can be subjected to other immune deficiencies, other diseases, or you may not get over a cold as fast, and those are not things you want to be encountering. Tanning salons are also not regulated, so you really don't know how many joules or how much energy you're really absorbing. Is it UVB, UVA, or both? Those are things that are not answered. We really don't know.
Well, what about different medications? Do people that on different meds have to be more careful of the sun?
Absolutely. There are certain drugs that make you more sun sensitive, such as tetracycline we use, or minocycline that we use in acne a lot. Certain blood pressure drugs do expose you to more sun absorption, so you can sunburn a lot easier. So it's good to check with your doctor and your pharmacist if you're not sure.
And what about the signs of skin cancer? Are there certain signs?
There are. we train ourselves and our medical students in recognizing those signs, and we also train our patients in looking for lesions that are new, that are changing, and that persist. So if something pops up that wasn't there previously, somewhere, especially in sun-exposed areas of the skin, but anywhere on the body, if that lesion begins to change in some way, and if it does not go away, we ask you to bring it to the attention of a qualified health care provider so that it can be evaluated. It may need a biopsy. It may need simply just an examination. But you really don't know without having it checked.
Well, I was visiting my nieces last weekend, and one of them put out her arm and showed me, she says, "Look, do you think that's cancer?" And I said, "No, I don't think so, but let's go over the ABCDs of skin cancer." Do you do that with your patients?
Absolutely. The first thing I tell them is sometimes skin cancers do not have any signs or symptoms, but usually they do present themselves as a sore, and you may have some bleeding and you didn't scratch the area. I have patients who would say, "I have this pimple on my face, it went away, but keep coming back in the same area." So those are signs to look for. They don't necessarily have to itch or be painful. So therefore, you may just feel like it's a nothing, but it just keeps occurring over and over. Other things like melanoma, we do go over the ABCDs. What we do for ABCDs are how we look at moles to tell whether those are moles that we have to be concerned about or biopsied. A stand for asymmetry. If a mole is asymmetric, those are signs that we have to start thinking about it, whether we need a biopsy or not. B, border. Is the border irregular or fussy? That's not a good sign. C is color. Any changes of color or a light mole suddenly turn dark. And D, diameter. Anything 6 millimeter or bigger, which is about the size of a pencil eraser. Now we have this E that's added, which is elevation. If a mole's been pretty flat and suddenly it becomes elevated and it changes the border, the color's changing, time to go talk to a dermatologist or a healthcare provider.
I would agree with Dr. McNay that we should emphasize the fact that we don't want our patients waiting until there's a symptom. Don't wait until there's bleeding or itch or pain. "Doctor, this mole really wasn't hurting." I get that response very frequently, and I agree with you. Don't wait until it hurts. If this is changing in some of the other ways that you outlined, bring it to the attention of your doctor as soon as possible.
I think Dr. Gorsulowsky also mentioned it, and I think it's a great point, is that just that it's not in a sun-exposed area doesn't mean it can be a skin cancer. I have plenty of patients when I do the full skin exam was surprised that I checked between the buttocks. And I said, you know, melanoma does not have to be in a sun-exposed area, and a lot of them didn't know that.
Well, Dr. Anderson, you pointed that out too, that you can get melanoma inside the eye.
And in its early stages, there are no symptoms whatsoever. The only way to really see it is with a regular eye examination and dilating the pupil and taking a good look into the eye.
Are there any people at increased risk of melanoma of the eye?
It's the same characteristics. The pale skin or blue eyes, lighter color complexion are more susceptible to eye melanomas as well.
What about family or genetics? Do they play a role?
You know, there isn't as much of a family history with eye melanomas as with some of the other melanomas, and perhaps one of the dermatologists would want to comment on skin melanomas.
Maybe because it's more rare, but when you see someone, have you seen a melanoma of the eye?
I have, yeah. It's not the most common cancer of the eye or around the eye, but yes, I've seen them.
Yeah. Well, Dr. Gorsulowsky, what about melanomas? Anything that you quiz people on in the office about them?
Yes, definitely. There is an inheritance factor with melanoma. And patients who have family members who have had melanoma specifically are definitely at increased risk for developing melanomas themselves. I can tell you about a family that we treat locally here in Fremont, and this family has some physicians who practice in the East Bay, and Dad has developed melanomas, son has developed melanomas, and now we are very vigilant. We're watching the grandchildren very carefully because we know that this family has an increased risk of of developing melanoma sometime during the lifetime, especially when we call it a first-degree relative. If your father or brother or sister has developed melanoma, you're definitely at increased risk. And so we caution very frequent examinations by us in the office.
I don't think that there's a gene test yet for that risk factor.
There is one gene or set of genes that has been associated with some types of melanoma. And interestingly, that same gene has come into play in some other cancers in the East Bay, specifically pancreatic cancer. There is a linkage between melanoma and pancreatic cancer with that specific type gene. Unfortunately, we have a higher than normal incidence of pancreatic cancer in the East Bay, and we don't know why. Is it because those patients with that gene and set of genes have settled here? Or is it because the sunlight turns on that gene and causes patients to develop pancreatic cancer or melanoma? We're not sure. But you are correct, Barbara, that we have a lot more work to do to uncover this genetic basis and why some people are more susceptible than others.
Well, come on, we've talked about all the bad things the sun does. What good things does the sun do?
Well, I believe sun gives you a good sense of well-being. That's why people go to the beach and want to lay out. You do feel good, and I think there were studies that show that the tanning effect gives you that endorphin feeling, the feeling good feeling. That's why people go to tanning booths. However, obviously, you know, the topic is we try to avoid that. But otherwise, there are some issues about, and controversy, I would say, how sun connects with vitamin D. It's a hot topic right now because the sun does, through the skin, help us make vitamin D.
Well, it activates the vitamin D
pathway.
is really not a vitamin, but it activates it, right?
Correct.
So
It's a hormone.
So, Dr. Gorsulowsky, how do you balance that? You know, here people have to get some vitamin D to make good bones and things like that, and yet they can't get too much sun or they can get skin cancers.
Our recommendations are clearly to increase the vitamin D levels. Right now, all the recent studies have shown that none of us have been receiving enough vitamin D. But increase the amount of vitamin D by dietary sources. Increase food intake with foods that are rich in vitamin D, as well as increasing vitamin D by oral supplementation, rather than by relying on sun exposure to get vitamin D. That doesn't work, especially with the darker skin. So to answer, increase your vitamin D intake if your physician says that you need vitamin D, but do it by oral supplementation rather than by sun exposure.
Is there a maximum amount of sun tanning time that you're supposed to do?
We know that we cannot restrict all sun exposure. That would be not practical. Many of us need to go out to the mailbox and check the mail or run to the grocery store for our lists of errands during the day. So how about trying to compromise? Instead of telling our patients don't ever go out during the day, clearly with the fairer skin types, we ask them to limit their direct in the sun exposure to 20 to 40 minutes or less, and with darker skin types a slight bit more. But the 2 to 3 hours, the 2 to 4 hours that are talked about in some of the literature are definitely excessive and definitely lead to excessive sun damage of the skin.
I agree with Dr. Gorsulowsky. I believe there are a lot of stories out there saying that you need certain amount of light. And I always tell my patient, we live in California because we love this outdoors environment. We like the nice sunshine, but just be protected. It's okay to be out there.
Well, and I guess we have to be vigilant too, because we spend a lot of time here in California driving. Correct. What about that?
Absolutely, and that's a good point, Barbara, because one thing that is not mentioned commonly is that UVA actually penetrates through glass and UVB doesn't. So we're still getting that aging ray through the light. And California is a big state. We're driving from Fremont to Disneyland. That's a good 5 to 6 hour drive easily. And during that time, you do need to reapply sunblock because the sunblock you may have applied hopefully have applied before you get into the car does not last that long. Or some patients just thought, or some people may think, I'm already in the car, I have the glass to protect me, I don't need to worry about it. And they are still getting that light.
Wow. And the hands. You got to remember your hands are up driving too.
Absolutely. And hands are a bit difficult because we do wash our hands during the day. It's a bit harder to remember to reapply, but that's a good point. That's a very good point.
And then, Dr. Anderson, last words. Tell us about driving and the sun with your eyes.
Well, as Dr. McNay mentioned, some of the UV rays can penetrate through the windshield, so it is important to wear UV protecting sunglasses on sunny days. And I also think the issue about reapplying sunscreen is very important. Even if you put the sunscreen on and it's a high sun protection factor, it just doesn't last as long as many people lead you to believe. And people end up getting sun exposure even if they're using sunscreen, and that's plenty sun exposure for vitamin D formation for those who believe that that's important. I think it's there's no such thing as protecting yourself from the sun too much. So.
Dr. Anderson, thank you. That's a good segue, because coming up next, we'll look into specific issues concerning sunscreens, what they do, what they don't. And we'll talk about what you should look for when you're buying a sunscreen product.
This is my linear accelerator.
This is my cardiologist.
This is my CT scanner.
This is my surgical tray.
This is our registered nurse.
This is my digital mammography center.
Washington Hospital is not owned by a corporation. It is owned by and open to everyone in our community, including you.
This is my hospital.
This is my hospital.
This is my hospital.
Every woman is unique. At the Washington Women's Center, we take a unique approach to your health. We offer a comfortable, supportive environment, state-of-the-art technology, health screenings and resources, and we're the first center in the Bay Area to be named a nationally accredited breast center. We're more than a health provider. We're your health partner. Call to schedule an appointment.
Washington on Wheels brings health services to people in the community who otherwise wouldn't have access to quality health care. And take it from us, there's nothing more frustrating than being denied access. To find out when Washington on Wheels is pulling into your community, go to our website.
There's two of them, the UV and UV.
UVA.
UVA, and there's another one, UVB, yeah. And price.
Okay, and price, obviously. Okay.
The different protections, make sure it's UVA, UVB. I also look for all the ingredients in the sunscreen. We're very concerned about what we're putting on our kids and myself and the family.
It's the UVA. The UVA, okay. The UVA, I think that's supposed to be the best protection.
The PFH factor, it's got to be at least 50 or more. And it's good to have it waterproof.
SPF of at least, for me, 15.
SPF over 45 and ease of application.
Things I look for in a sunscreen is a high SPF.
I've heard also that 50 SPF is good enough, but I use a children's one that has 100 just in case. You know, it never hurts to try too much.
Sun protected fluid. Number of hours that it works.
I know the higher it is, the better it is, but...
Sun, something.
The higher SPF, the more protection it gives you in the sun.
Sun protection, oh boy.
Sun protection factor?
SPF stands for sun protection factor.
There's a certain degree for each amount, from SPF 20 to 40 to 50.
I don't know exactly what the number means. I know the higher the number, the more protection that you have, but I've been told that there really is no use in anything above 15, that anything above that is not really any more effective.
Higher the SPF, the longer I can stay out in the sun.
45 times longer in the sun with sunscreen than without sunscreen is, I think, what it means. But mostly it just means every 45 minutes I put it back on.
Seems like there's a lot of confusion and misinformation about sunscreens. The product label makes many claims, but are they reliable? What do these claims really mean? And how should we choose the right sunscreen? Dr. McNay, how do sunscreens work?
That's a good question. It's a little complicated. There's two categories of sunblock. There are physical sunblock, which act as a barrier. It basically, the zinc oxide or titanium oxide in these type of physical block combined with the stratum corneum and blocks the light.
And the stratum corneum is the top layer of skin.
The top layer of the skin, correct. Then there's this chemical block, which is more common, and that's when things get really complicated. Chemical blocks are more readily available, and some of them only block UVB, and some of them do combine with a little ultraviolet before it become active. Now, as American Academy of Dermatology has recommended, we actually recommend broad spectrum sunblock. So now there are chemical blocks that block UVA and UVB. So it gets the consumer a little bit confused, and sometimes I'm a little confused myself. But overall, I recommend physical blocks, zinc and titanium, but otherwise look for a sunscreen that says on the label UVA, UVB, broad spectrum, and now we recommend at least an SPF 30 or higher, and it should say water resistant on it. And that's another issue about water resistant.
Wow, well, why don't you attack that issue, Dr. Gorsulowsky? What is water resistant? And tell us what SPF means, too.
The most important factor in looking for a sunscreen is the sun protection factor, SPF. Those numbers that are listed on sunscreens refer to the amount of protection that is afforded against UVB only. Those numbers do not relate to UVA. UVA protection is important because we have said in previous sessions that UVA contributes to aging of the skin and damage to the skin as well. So that UVA, UVB blocker is important, but the number that is listed is called the sun protection factor. And that number refers to the amount of protection, once again, against UVB. A common misconception about the sun protection factor is that it is not a measure of strength of the sunscreen. A patient brought me a tube of sunscreen recently that had a rating of 100 on it and said, I am being a good boy, I'm really protecting as you told me to do, Dr. G, I'm using a strong sunscreen. The number is not a measure of strength, but it's a measure of length of time that the person is protected. For example, if you, Dr. Kostick, were to burn in 10 minutes in the sun with no protection, no sunscreen, an SPF of 2 would then allow you to be in the sun for 20 minutes before you burn, twice as long as no protection at all. And that's why Dr. McNay recommended a sun protection factor of 30 or greater, and certainly at the very minimum 15 or greater, because that is the length of time that you're going to be out basically in the middle of the day anyway. So the number, don't be confused by the number. The number is there to give you a guide to the amount of protection from UVB. We're still awaiting a good system for rating protection from UVA, and there are some systems that are in the works right now with a star rating system, and that will be more to come in one of the upcoming sessions.
So we have to look at, when we look at the label, we have to check for the SPF factor and a star factor, is that right?
The star factor has not yet become widespread, so be aware that it's there, and we'll see it more and more on sunscreens. And as it is more standardized, then we'll come back to you with some more recommendations with the higher ratings, the higher number of stars being more protective. One of the other points you brought up, though, was about waterproof, water-resistant claims. The FDA has asked all of the sunscreen makers to discontinue using the term waterproof, because it was misused and it was applied to many sunscreens that would wash off even with just perspiration. So the term water resistant is the one that you'll see in the drugstores, in the pharmacies, on the sunscreen labels now. And those claims for water resistant, again, are not regulated. So how water resistant really is water resistant? Can you be in the water for 30 minutes? There are standardized definitions of that, and the FDA has tried to standardize that, and for 30 to 60 minutes in water without the sunscreen washing off. Still, look for a water-resistant sunscreen, and we can tell you in the office setting about some sunscreens that truly can be applied infrequently, that are good for our scuba divers and our snorkelers and swimmers. During the summer, swim teams are going on. We recommend specific, very water-resistant sunscreens for our patients where they can apply them once, be in the water for the 2-hour workout, 4-hour workout, and the sunscreen truly stays on. So it is variable from one to the other.
Well, I just used to use that zinc paste, you know, right there.
That was
zinc
quite
oxide.
That's good. That's the best stuff.
That's the best. And
yeah,
it is.
It has made a return. Dr. McNay brought this up, and zinc oxide is now one of the physical sunscreens. We have prepared a list of ingredients to look for on a sunscreen, and you can see that on your screen at this point. Some of the sunscreens sunscreen ingredients listed on the screen are those that Dr. McNay talked about and are chemical sunscreens, but the two listed together, titanium dioxide and zinc oxide, are those physical sunscreens, and no longer do you have to have the white paste look on the nose. These are dispersed in an elegant fashion in the sunscreens, and they don't make you look pasty. Use them.
What would you look at then for the label? Did you say you'd look at the label and you would say that it was...
I'll tell you what the American Academy of Dermatology recommend, because this the official word is SPF 30, broad spectrum, and it should say UVA/UVB, water resistant.
That sounds pretty clear. What about sunglasses? What do we do about those?
Well, there's no SPF factor for sunglasses. Sunglasses are categorized by how much UVA and UVB protection, or how much blocking they provide. And really, it's required to have 99 or 100% UVA and UVB protection to be considered a really good pair of sunglasses.
What about the shape of the sunglasses or anything? Do those make a difference?
They can make a big difference. If you're in a high sun exposure area, for instance, at the beach, or if you're skiing, you definitely should wear sunglasses that have a little bit of a wrap to them. A lot of the ski glasses actually have a hood on the side to completely block sun exposure, because there's an amazing amount of light that can come in from the side of the sunglasses and still potentially cause eye damage. Sometimes poor-fitting sunglasses, they'll come down your nose a bit, and sun can come from above. So a hat is also a good idea to protect the eyes, and obviously it's a good idea to protect the ears and the scalp and the neck as well.
Is a darker color an indication that it's a better glass?
Well, there are a lot of misconceptions when looking at sunglasses. The amount of tint, the darkness of the tint, doesn't really say anything about the UVA and UVB protection. You can even, by prescription, have a clear coating put on clear glasses that will filter out UVA and UVB rays. So the important thing is, when you're purchasing a pair of sunglasses, be sure to find a label or a sticker and make sure that label says 99 or 100% UVA and UVB protection. A lot of my patients also ask about polarization. Polarization is a process that can be applied to sunglasses to really decrease glare. It works very well for reducing glare, but polarization by itself doesn't protect from UVA and UVB rays. The blue blocker glasses that have that yellow or amber color, they're also good at reducing glare. A lot of fishermen, a lot of people who drive for a living like to wear those glasses. And they do reduce glare, but by themselves they don't protect from UVA or UVB rays. Having a tint where it's darker on the top and more clear on the bottom, again, that's helpful when you're outside and the sun is high in the sky. It helps reduce the sun intensity, but again, it's not protecting you from UVA and UVB. Most of these glasses will have the additional coating on them, and you can still find a sticker on them that says protects UVA and UVB. But the bottom line is you have to find a label that says UVA or UVB protection 99 or 100%.
Well, you know, you talked about how the sun can damage your eyes and cause, you know, the leading cause of blindness, macular degeneration. And this is an aging process as people get older. And I really like that concept that you brought up, that they can have their prescription glasses made with UVA, UVB protection, but it doesn't tint the glass or make it harder for them to see out of it so that they trip and hurt themselves, and yet they'll still protect their eyes. So I think that's something we need to talk about, that when we have our prescription glasses made, we should probably request that. Pay that extra $10.
It's a good idea to do that for protection. There are even some types of plastics that lenses are made out of that naturally filter UVA and UVB. Polycarbonate is one of those plastics.
Wow.
But yes, when ordering prescription glasses, it's always wise to ask, what kind of UV protection am I getting? And do I need to put a UV coating on there for better protection, even with clear lenses?
And glasses, you know, the shape you said, the wraparounds, so we can't always wear wraparounds.
Right.
So I guess we have to look at protective clothing for the sun too. Let's talk about, I'm a new parent and I've just had my baby. How do you counsel your patients about their babies?
We do not recommend using any sunscreen on a child under 6 months or younger because their body surface area is so big compared to how much they're going to absorb. Therefore, we recommend just protection, avoiding the sun, putting clothing that cover them, and then it gets a little controversial, I think, between 6 months and 2 years. I still, at that point, recommend parents to just keep them out of the sun, if possible. Sun hats, clothing, and then 2 and up, I prefer the sunscreen that are physical type, mainly zinc and titanium, better than chemicals, less sensitivity with the children. And starting them young, I tend to tell parents that when they start teaching the children how to brush their teeth and wash their face in the morning, to just put in the sunblock. So that's something that they will build a habit, and hopefully for life.
What about eyes in babies? Anything with them?
Well, in very young children, in babies, it's hard to get a pair of sunglasses that will fit, and if you can find a pair that'll fit, they'll be torn off instantly. So wearing a hat, or when you have the baby strollers or the carriers, they have the hood that you can put up over and provide some shade. So in very young children, it's more hats and protection, shade, things like that. As a child gets into sports and does a lot more outside activities, even 10 or 15 years ago, ophthalmologists were not really recommending sunglasses or didn't feel a strong need to recommend them. But nowadays, it is a standard recommendation that when children are in sports, outdoors a lot, especially in the summertime, go ahead and protect the eyes with sunglasses. And then if you're going to the beach, if you're going skiing, then sun protection really should be mandatory in those high exposure areas. So.
And Steve, isn't it a lot just common sense as well at any age to not receive excessive sun exposure? Instead of prolonging that episode at the beach or the backyard, barbecue or whatever, to shorten it and to really try to concentrate those activities at non-peak sun times?
Right, that makes common sense. Avoiding the stimulus that can cause problems is always the safest way to go, and then protect yourself if you really do have to be out there at those times.
So you're saying that in August, when all the boys in football are doing their double days, it's really good to do it early in the morning and late afternoon and not in the middle of the day, and make sure they get enough water.
Right.
What about children? How would you protect them from the sun?
We highly recommend the use of clothing that blocks the damaging rays of the sun. There are several brands. You and your doctors may discuss those specific brands, and they protect very well from the sun. There is an ultraviolet protection factor that is noted on much of the clothing. If it's reliable clothing and if it's done appropriately, you'll see that protection rating on the clothing, just like Dr. Anderson mentioned about the glasses. Look for that rating and look specifically for clothing that has been designed to protect from the sun. And not just in children, Barbara. All of us should be thinking about that, because the light-colored shirts that many of us wear to the beach may allow ultraviolet to penetrate through the clothing, and unless it is specifically designed to protect. The hats that we wear need to protect, as the eyeglasses, you said, need to wrap around. Our hats, if it's only a baseball cap, really doesn't provide much protection. So the broad-brimmed hats, with or without the Foreign Legion addition to the back of the hat. So how do we do it? Common sense plus clothing that protects from the sun.
Is the clothing coated, or why is the clothing protective?
The clothing is protective because woven into the fabric is a certain chemical that then stays in the clothing, even with washing, and that blocks the damaging rays.
So it means that if we buy this clothing, we should read the washing labels, the care instructions, because maybe they don't want bleach or don't want something, right?
Correct.
You have children. What do you do?
Everything that Dr. Gorsulowsky has mentioned. Definitely hats, shirts, jackets. And I have to emphasize that these clothing don't have to look ugly, because sometimes patients get concerned about the way it looks, and they don't have to be bulky. It's a misconception they have to wear a ski jacket to cover themselves from the sunlight. These made UPF labeled, which, by the way, UPF is the same as SPF. So if SPF 30 and UPF 30 is the same in terms of protection. These are very elegant and they're thin. I can wear, actually I own a few myself. When I go hike Mission Peak, I have my Legionnaire's hat on with a wide brim and the flap on my back to cover my ears and the back of my neck.
Do you wear your driving gloves too?
No, actually, I have a long sleeve. I usually just tuck it in like this, or I have to, use my poles. When you go up in elevation, there's more ultraviolet light too. So
that's a good point.
So they're light. I can walk up there sweating and huffing and puffing, but I don't feel too hot because they are not very thick.
What about teenagers? Do they have any special problems with sunscreens?
Absolutely. First of all, they may be adverse to it because they don't want to put more cream on their face of acne issues. Girls don't want to take off their makeup in the middle of the day and apply another layer of cream. So there are different ways to get around this. First of all, wearing sunblock layer powder for girls who wear makeup are easier. They don't have to take off all the makeup. A lot of them are non-comedogenic, so it doesn't clog their pores. They tend to play a lot of sports at this time. I know a lot of them like to wear baseball caps or visors, which are not a good idea, as Dr. Gorsulowsky has brought up, that a hat with a wide brim is better. Also, protecting the scalp is very important because despite we have hair at this age, it doesn't mean that you're getting protection from the ultraviolet radiation. And same with the lips. We do see skin cancers on the lips as well.
Let's go back to hair. What kind of sunscreen would you use for your hair?
That's a very good question. I would say when I was in training, there's not much. It's pretty much a cream and no one wants to do it and you can barely get them to put on the part. Now, in terms of sunscreen, the powder is a good option. There are sprays. However, the sprays need to be rubbed in. A lot of patients kind of go like this airbrush and thought they covered and they're not. So actually, after you've sprayed it, it's a good idea to actually physically massage it into your skin. There are foam-based sunblock. Those are great for not just the scalp hair, but for gentlemen who have hair on the chest or hair on their arms. It's much more elegant than a thick, sticky piece of sunblock cream as such.
Well, what about all these different ones? Do they all work equally well too? All the different kinds?
Some of our bright scientists have gone back to the laboratory and checked out these substances, these sunscreens, to answer that question. Because we are busy recommending sunscreens to patients, we hope that we're recommending something that's effective. And interestingly, some of the lipsticks, for example, that say that they have sun protection factors of 20, truly, when looked at in the laboratory, had a sun protection factor of 2. So how reliable are all the claims that are made with over-the-counter, unregulated products. We have to rely somewhat on the trustworthiness of the manufacturers. Generally, the main brand names are reliable, and we've looked at how often they need to be applied, as you just mentioned.
Mm-hmm.
How often would you reapply a 15 or 30 sun protection factor sunscreen to your skin? And some of the studies have shown that when we, humans, use sunscreens, we don't apply enough. We are applying too little, we're not rubbing them in, and we're not reapplying them often enough. So we have some recommendations regarding that.
Okay.
Go with a name brand sunscreen, and those that sound generic and may save you some money up front may not be as reliable. We don't know. We cannot say whether they are or not. But name brand with a sun protection factor of 30 or greater, broad spectrum, water resistant, and reapply every 2 to 4 hours, especially when you are going to be in a moist environment, like you're perspiring a lot or swimming or in and out of the pool in the backyard in between other events. Reapply. And then the protection is pretty reliable.
So we're protecting against sun damaged skin, possible turning into cancer. But some people feel that maybe these sunscreens can cause cancer themselves.
There are several chemical sunscreens that have been called into question. And one of them is a vitamin A derivative called retinol palmitate. Mm-hmm. That recently was looked at as a possible negative rather than a positive. And we're telling you to put that on your skin. And we can tell you that that chemical and some others may cause some problems in the laboratory setting. However, in humans, there is no evidence that the readily available sunscreens, Barbara, are harmful to the skin. And those main name brands are the ones that we rely on. We still recommend daily use of those sunscreens. Until we have more evidence, there is plenty of evidence that unprotected exposure is going to lead to some problems. And we have enough long-term use of most of the main chemical and physical sunscreens, as outlined by Dr. McNay, that we can recommend them without hesitation at this point.
Do you give certain subgroups different kinds of recommendations for sunscreens? Like some you would recommend the barrier versus some you would recommend the chemical? I mean, it sounds like if they want it long-term or scuba diving, they need a chemical, but...
Generally, the broad spectrum sunscreens that include the physical sunscreen as well as the chemical sunscreen are adequate for almost all applications, all types of jobs, outdoor jobs, and outdoor activities. So not very specific UVB blocker for this kind of occupation, no. Mm-hmm. Broad spectrum for everyone really is what we want, including that protection of the lower lips. Dr. Anderson earlier talked about how the lower eyelid is a favorite place for skin cancers when they occur on the eyelids. The same thing happens with the lower lips. Mm-hmm. Because of the angle of the sun, the lower lip in us receives a lot more damage than the upper lips. And regularly patients say to me, that's just dry lip. That really isn't sun damage. And then I ask them to say, why is your why is your lower lip scaly, flaky, and may have some sores, and your upper lip doesn't? Ah, you bring up a good point, Dr. G. So the sun has been beating down on these lips by the time we are several years old. One of our local internists internal medicine doctor sent me his son to see at age 16 for acne. And I looked at him, blonde-haired, blue-eyed young man, and his lower lip looked like a 60-year-old's lower lip, not his upper lip. And I found out he's a swimmer, and he's a diligent swimmer. He's really good at it. He's been swimming since age 1 in the pool every day, and he has damaged his lip irreversibly. So get your kids started early with sun protection. And the lip balms that have a sun protection factor of 30 or greater are the ones that we recommend. And reapply frequently because of licking of the lips, drinking of fluids, and other things that will wash that away.
Okay, well, we've been talking a lot about prevention, but then you have the 40-year-old woman that comes in that was a sunbather for the last 20 years, and now she wants to reverse that aging process. Is there anything that they can do easily outside of surgery and special procedures to help with aging skin?
Actually, yes. A lot of my patients come in and they said, okay, I heard about this procedure, that procedure, this miracle cream. What should I use? And I still go back to the first go-to. I said, the first thing you do is start your sunblock. And then they will say, but I already got my sun. What am I going to do now? And I said, you know, you understand, your skin is a very smart organ. It's constantly taking care of previous damage. So if you're still damaging your skin now, it really can only do so much. But if you start protecting yourself now, your skin have a chance to take care of the damage that you had before. But in the meantime, let's start with a couple other things aside the sunblock that I just mentioned. Vitamin C is a good product. It is a mild antioxidant, so it does help the skin to repair the damage that we had done before with UV damage. It's actually a very light sunblock, believe it or not. It also have a light bleaching ability. So for a 40-year-old woman who had some sun, usually there's a little bit of a brown discoloration here and there. So that does help. Vitamin A, either over-the-counter type or prescription line are helpful. It does help the skin to turn over regularly. But that does make you sun sensitive. So we apply that at night. And we have to weigh the consequences, but that may also encourage the patient to wear the sunblock
Now,
more.
the vitamin C, did you mean that you take that naturally, or did you mean the topical Cs?
Orally, I don't think have shown that much changes at this point.
So the topical antioxidant vitamins do work?
They do have some effect. The data are still being developed on these, as Dr. McNay has said. But one of the ones that has the most scientific data behind it is the group of vitamin A prescription creams. And we've done research on that and shown that some of the vitamin A prescription creams sold under some of the very popular brand names not only will change the color of the skin and smooth the tone of the skin and smooth the fine wrinkle lines of the skin, but also change that second layer, the dermis, and actually help it to repair faster. So there's an old saying in Louisiana where I came from about not having an effect because we're closing the barn door after the horse is out. In this case, we now can cheat a little bit. It doesn't give us a license to go out and sit in the sun, but for mild to moderate improvement of some of that sun damage that has been done, some of those prescription creams can actually reverse those effects on the skin and make the skin repair itself.
Well, you know, vitamin A, is that one of the vitamins we're supposed to take to help prevent macular degeneration?
It is one of the vitamins. All of the antioxidant vitamins A and C and E and the mineral zinc to some extent as well are good for treating macular degeneration. In fact, for the most common form of macular degeneration, that's the only treatment available at this time. The studies are still not conclusive as to how much of a beneficial preventive effect vitamin A or the other antioxidant vitamins have. But I do know that if I had a family history of macular degeneration, I would be taking antioxidant vitamins or just trying to have a healthy diet with fruits and vegetables, because vitamin A is important to the eyes in many regards, not just with macular degeneration.
And do you wear sunglasses?
I do wear sunglasses, and I check the label to be sure they're 100% filtering, yes.
Are they the wraparounds?
I have more than one pair of sunglasses, and when I am outside in the bright sun, I do have wraparound sunglasses, yeah.
So last chance, one more tip. Anybody want to give one more tip to our people about sunscreens and sun?
Remember that sun damage is cumulative. It's like a bank. So it may not give it all to you when you're younger. This is for a younger audience. It will give it to you later with interest. So it's better to start young and start that protection.
Okay.
And remember that sunscreens alone are not enough to protect from development of skin cancers and premature aging of the skin. Use some common sense. Use those protective measures that we talked about with clothing, with hats, with sitting in the shade rather than in the sun, and avoid peak sun times between the hours of 10 and 4 during the day to limit the amount of sun damaging rays of the sun.
Okay, and Dr. Anderson, the eyes have it for the last word.
Okay, for ocular protection, you want to be sure that you have 99 or 100% UVA and UVB protection in your sunglasses, and it's always wise to wear a broad-brimmed hat as well.
Thank you, Dr. Anderson, and thank you all for participating in our discussion and for offering crucial insights into the dangers of prolonged exposure to the sun, and for helping us to better understand what we can do to protect ourselves from sun-damaged eyes and skin. And thanks for watching the session of Your Concerns in Health. For more information on protecting yourself and your family from the harmful rays of the sun, talk to your doctor and visit the following links.